Let's give it 1 or 2 more minutes and see if more people are joining in. Hi, Vijay. Hi, Arpit. All right, welcome everybody. Thank you for joining the session. We'll just give 2, 3 more minutes and let more people come in and join so that our speakers can share their experience with you all. Hi, Sausan. Hi, Garima. Hello, Maitri. Hi, Richa. Hi, Mokshita. I'm also happy to see you. So, all right, guys, as you all know, we are meeting today to have this beautiful celebration meeting for our March 25 winners. We have had such amazing scores and results and so many passes this time, almost 153 candidates that we have recorded on paper. So, those who have cleared and passed this examination with us. And I have requested as many of them could who could join us and share their experience with you all. I know a lot of you have joined us for September. Most importantly, those who are going to take the examination in the September 25 intake. This session is going to be extremely helpful for all of you, whether you have started your preparation or you're thinking, or if you missed out also this time. This session is also for you because I discussed with speakers, we are going to be also talking about that a lot of them had their second attempt or third attempt as well this time. Many of those also cleared in their first attempt, but we did have the repeat attempters as well, especially from the September 24 examination when it was extremely difficult set of papers. So we are going to be talking about all the aspects, whether it's a reattempt, whether it's the first attempt, what your approach should be, how to keep a positive frame of mind when I think every second person you meet might try to demotivate you. So that approach also needs to be organized. So considering all of that, I will be requesting one speaker at a time. Hi, Diksha, I see you there. So I'll also line you. And we'll start with Veena first. And I would like to congratulate you all, first of all, for getting your fabulous results and taking out the time, contributing your experience, sharing it with all of us here today. We can take away learning points. I, including myself, including as well, because it helps me also align the program in a better way. So do give me and do give us, everyone, your valuable insights, and then we'll take it from there. So, Veena, I would like to request you, please.
Hello, hi, Dr. Jigyasa, and hello, everyone. My name is Dr. Veena. I would like to share my experience and also few things people started asking me after I I passed in the group. The most common doubts of all the people who are taking ADC exam. So I would first like to say this was the second attempt of me. Passing the ADC exam. So the first attempt, what really happened was I moved to Melbourne last year after my marriage, and the exam was in September, I guess, and I joined the course in June. The exam was in September 11, 12, and I moved to Melbourne mid August, and I literally studied only for 15 days. The main notes that of Dr. Jigyasa, the files, the TG, ICG, only for the 15 days, whatever notes that were there, I read those. the advanced file, the mega master file, and trust me, I cleared three papers and I didn't clear one paper, one cluster. And even and that mistake I realized when I did the exam. I couldn't read the file, advanced file, many times because I had only 15 days time. So I realized after the exam I have made very silly mistakes, and I even after exam I told Dr. Jigyasa that the question I knew I marked it right first, and then I changed it to the wrong answer. And and when the results came, I knew I wouldn't clear, but still I cleared three papers with A grade, and only one paper I couldn't clear, or one cluster I couldn't clear, and that was okay because I did not have proper time. So for the next March exam, I decided I'll start a little early. And still, I started around January, mid January, properly to sit in studies 8 to 10 hours a day. And I gave my everything. And this time, I revised better. I did all the files again and again, and and finally, I could clear the exam this time. So, the most common doubts people are asking me now is for those who could not, who are able to follow the weekly plan well and good, and it is the best thing to do because it is very organized. Organized way, like which one you have to go start first and which one you have to read first, so that you gain information in a very customized way, in a proper systematic way. But for people who are not able to do the weekly plan, or who are not able to do the daily plan, who still feel there are backlogs, or we are not able to complete the video, I want to share my experience. I really did not follow the weekly plan because I had to work as well. So I think at 4 weeks before the exam, I stopped working. Till then, I was working, and then I did the week whatever main files I thought. Apart from the because I had already done the advanced file and mega master file last time, I did the things which I had not done, and I've gone through those videos at, only once, I guess, and I did my own revision after that. And whatever notes whatever important points or concept wise, whatever she told me, I would make small notes of that. And when studying each and every question, I would imagine, what if this option was not given? What would be my next answer? And trust me, only that was the main thing that happened during this exam, because few questions they were not was like the main answer, the straightforward answer was taken off, and the next option was given. So that is the main thing that you learn while solving these questions and in advanced file. uh, like what if if the direct option is not given, what would be the next choice? And I would say you should do the advanced file as many times as possible with the variations that Dr. Jigyasa teaches in the class, because that is the main thing that comes in the exam. I'm sure that will come in the exam. And TG, ICG, whatever guidelines are there that she says. And the most other question that everyone asks is if you have to do all the articles that is put on in the Google Drive. So for us, actually, the hot notes that is there, that is a part of the app now. It came midway. So what we had done the articles. I had a study partner, so we had done the articles way ahead. From December, we used to do 3 4 articles per day, and we completed those articles by January end. So for this September batch, I guess you have the hot notes in which all the articles are in one place, and you have the main points of those articles. So I guess it is very easy for you guys to just directly go through those hot notes, because it directly gives you information that you need. You need not sit and read the entire article from introduction to the conclusion. So that is one thing I want to say. You can go through the hot notes. You cannot complete everything one day, or complete all the videos one day, or in a week or week time. So you just follow the weekly plan. If not possible, the main files that are there, you focus that you do the TG 15 pages per day, and do it for like 2 weeks, and you complete it. Then once you do that, and again you start doing the TG, increase the number of pages. So every day, my plan was, I used to do TG, I used to do the infection control, I used to do the advanced file, I used to do the mega master file. And once this is complete, and I will do the remaining videos that are not that I've not done before, or the important article classes, and then I go back to those questions and correlate those questions. If some question in advanced file had some link to the article which Dr. Jigyasa mentions in each and every advanced file classes, so I used to go back to that article, and I used to find that point where that point is given, and I used to read that particular paragraph, or if that is important, or if that is highlighted in the drive, I used to read that. So that is how you link your questions to the articles that are given. So these were the main important points, and obviously you get many new questions every time, but I think you will be prepared to answer those questions, like through the classes that she takes, and you will be trained in a way, you will be trained to think in a way that you will
Takes
approach
best to be done.
right.
Any elective dental treatment is safest to be done in the second trimester, which is from week 14 to week 28. Is it clear now, Consular?
Yeah, yeah, yeah. Sorry.
Somebody was
So
watching our session in
yeah.
between the session.
So
So,
every day there's some part of her video that I watch, which is also, you feel like you are engaged in some way, and there is some new information that you keep gaining. So this is how I did, and these were the main things that people ask if you're not able to follow the weekly plan, or if you have to read all the articles or hot notes, and if you have to, and someone even asked me, should I join multiple coaching? Then I said, no, please don't do that mistake, because in this, I think in this Winspert coaching, you are trained properly. And like I told you, for 15 days when I could clear, this is not like a wrong, I'm not spreading wrong information. I'm not telling you to read just for 15 days. It's just how her material is very important for the ADC exam. So that point you have to keep in mind. And if you're not able to look into all the videos, and you're not able to complete the weekly plan, it's okay. It's not like you're falling behind. It's okay. You just, if keep the backlogs, keep you can make notes of what videos you did not watch, and whenever you have time, sit around, see and watch. And every day I used to go to library. I did not sit at home. I used to go to library. I used to take my AirPods, and just sit and watch the video. It's so relaxing. She's doing all the job for you, and you need not just put too much pressure. It is very easy, like how to answer the question. It is joyful. It is not even stressful. So that is one thing. It really becomes stressful towards the exam if you're not. If the TG is a very volatile book, you just forget TG. Like how many times ever you read, you will forget things from that. So it's not a problem. You just keep reading as many times as possible. I can tell you one question, emergency question from TG. This exam also I made a mistake. So it's okay. It's not like you can just memorize everything and you can remember everything. So just don't take too much stress, and don't confuse yourself too much. Just the files that I told you and whatever she says. If you're not able to complete, you do read the most important ones, and then you do the remaining things which you're not able to do when you have free time. So, and very all the very best, and you have a lot of time now. I'm sure everyone will pass in your first attempt the next time. Even if you're not able to, it's okay. I had my story. I told you everything. So it's possible. It's not like a very difficult exam, so it's crackable. So thank you guys. I hope my information was useful. And thank you,
thank
Dr. Jigyasa, for all the help. And she used to answer me personally. Like when I
oh, thank you.
messaged her,
Thank you so much.
she replies me personally, and then that my husband used to say, oh my god, she is having so many people in the coaching, and still she replies personally to everyone, and that is a very big thing. Like you feel that there you have a support throughout. So thank you for that.
Thank you. Thank you so much, Veena. Thank you for taking out the time. Thank you. Valuable insights, and I'm sure it will give students a flexible approach also, that they don't have to get scared of the study plan. There are still flexible ways to manage it. And now that I have also made a lot of classes optional because new content has been added. So of course, students have a lot of flexibility to do the program as per the hours that they have. So I will now request Amar, would you please like to come and just check your video if it works, please?
Yes, ma'am, I'm trying to, but it's not working. Hi, everyone. I'm Dr. Amar Narayan. And I had, like what Veena just said, I had written the exam in September 2024 as well, and narrowly failed the exam. I cleared three clusters, and the fourth cluster, I think, was one of the clusters, I think, was clinical treatment evaluation, which I didn't pass. So then I had actually come across Dr. Jigyasa's coaching earlier, but I was late. So in June or July, I had found out about her, and then it was I wasn't really prepared to, or I was not really prepared to go ahead with her at that point in time. But why I'm mentioning this is that after failing, I sent her a note. I sent her a message that this happened, and do you think I do have do I have a chance the next time? And she was very encouraging and supportive. She said, in fact, to the extent she said that um, there was some delay in the fee paying. So she even said, join the course immediately and you can pay later, kind of a thing. So she's that supportive, is what I'm saying. And that was really, I really appreciate that. And now coming to the exam per se, it is very much doable. It is tough, but it is doable. And you need to have the right mindset and the right material to go through with it. So material is being provided to you, guidance is being provided to you by Winspert. And this I'm not saying as just to, just praise Dr. Jigyasa. I really mean it. It's like you have to really experience it. You have to read all the material and then do the exam. In the exam, you will feel that, oh, yeah, she taught this in the class. Oh, yes, this was discussed in the class. Everything will come back to you. And now with the hot notes and the advanced files and the power notes, it's even more like a breeze. You can go through the entire dentistry. Whatever topics are asked, every topic is covered. So my take on that is when you are reading the material, you should, I think, just try to learn it at the first instance itself, so that the next, when you repeat it, it's like a repetition, it's a revision, you just sits in your mind. And my way of studying was I would read her notes first, then listen to the videos. It really helped me a lot. You could do that as well, or you could devise your own way of doing it. I mean, some people just listen to the videos and they're okay with that. But for me, I need to read stuff myself, so that's the thing, which is what I do. um, with regards to the prep, it really helped me big time in this exam, because earlier when I'd taken the exam, I had studied on my own, and of course I'd studied TG and I'd studied Odell, but it was not as focused a reading as Winspert and Dr. Jigyasa's coaching provides. It's a very focused, very no nonsense kind of teaching or material where you don't go astray and don't read up all the unnecessary stuff. So that is one thing. And studying with so many people, going through the exam at the same time, being a part of a WhatsApp group really helped, because we used to discuss a lot of things on the WhatsApp. And like Veena mentioned, ma'am would personally reply to queries as well. I'm also a witness to that, and I have had a few questions that I had asked her, and she has responded as gracious as ever. Um, the thing is that you need to work hard, but she's doing her bit, you need to do your bit. And you want to pass the exam for, it's in September, I think it's 5 months from now. There's ample time, but use the time judiciously. What I would say is I made up like a lifestyle kind of a change. I used to wake up early, go for a walk, have a fresh mind, I'm a full-time practicing dentist, so I had moved all my appointments in such a way that it would be that I would have a afternoon window where I would not have any appointments, and that was my study time. And the night again, after work hours, I would study for a couple of hours. So in all, I've given about 6 hours per day quality time, and I think that much is required. It's difficult sometimes because if you could somebody could be having kids, Somebody could be living in a joint family. They could be working, but 5 hours per day. I think 24 hours everybody has in a day, and 5 hours of quality time we have to make that. That's my suggestion. The important books, of course, first and foremost is the material. It covers everything. But if you're like me who likes to read on their own, then of course you could read Odell and you could read TG as well. If you like the hard copy reading, I do that. I print out stuff and then read and then I listen to the videos. So that's my way of studying, and that's a suggestion that I can put forth to you all. Um, Please don't miss out on the important articles, the hot notes and the power notes. These are like, they contain everything. On top of that, if you want to study more, of course, you can go ahead, and it's of course going to improve your dentistry as well. It's not just about the exam. This material also helps you with so much of latest developments in dentistry, so many materials which we don't really think when we are practicing dentistry. But I have, in fact, now incorporated again after the course. Now I'm practicing dentistry in a way that probably in future in Australia I would be expected to practice that way. So why not provide the same service to the people that you are working with right now? So yeah, something of that sort. It's an ethical mind frame shift, I think, which has come to me after doing this course as well. How to handle motivation? I mean, you need to. I mean, everybody has their own motives to study for this exam. Um, I think you have to be really motivated on your own, firstly. And if you do lack motivation, I think you should listen to Jigyasa Ma'am's videos. It'll motivate you enough. She in the videos, she will pull you up now and then, and she'll like, you better study, you better do this, you better do that. That's the kind of push you need from time to time that she reminds you. She's like a real teacher. She's amazing. Handle stress. Yeah, I would say that if you can practice deep breathing and morning walks, it will really help with your stress management in the long run. Deep breathing really helps with vagus reset, and it's a documented, proven thing. So for your own lifestyle as well, I would recommend it highly. Eat well, please eat well, exercise a little bit. It's an exam which has been designed for working professionals, so you don't have to go back to really theory, but it's very application-based theory. You need to study the notes that is being provided to you by Winspert and apply it. Apply it. Don't just try to blindly mug anything. Just keep it like the concepts are like really crystal clear, and you need to have it so that when there are exceptions in the exams or there are different variations that come in the exam, you are able to handle it correctly. As far as attempts go, I think I've already mentioned that this is my second attempt. And I'm sure many of us here are also thinking about how many attempts and all of that. I think it's also something to do with timing. It's um, it's in your own time, it will happen, but keep at it. You need to do your bit and then pray and leave the rest. You can't control everything. Things that you can't control, you shouldn't worry about. Things that you can control are your studying, your timetable, your showing up every day. All that is in your control. Please do that. Don't cheat yourself by not working hard. I think that's what I will say. Prepare well, eat well, study hard, and then yeah, keep learning. I think it was very enjoyable. I didn't really feel this. I think I really felt that if Dr. Jigyasa was my tutor in college, I would have enjoyed some of the subjects much more. This was like she makes it a breeze. It's really good. So you should go through. I mean, you'll enjoy it and make it more like an enjoyment. Don't take it as a punishment that oh you need to get through it. You need to get through it. You will get through it in your own time. Study hard. All the best for everyone.
Well, thank you so much, Amar. Such crisp and very important information that you've delivered here. I have few very good questions. Can I just quickly ask you, and would you like to throw some light on them? If you
Sure,
can,
ma'am.
yeah. So Nimra asked, was anything out of ma'am's syllabus and other books that you did other than the course? How did you cope up with studying every day? So tips and studying every day you've already covered, but what about anything outside the syllabus is required other than the notes and power notes and then your classes?
So the notes comprise everything. I mean, there's nothing that she has left out in this material. Like, for example, if I have to give you an example of anything, if you look at discolored teeth, there's an entire plethora of notes on how to manage discoloration caused to various causes. You can take fluorosis, you can take tetracycline, you can take whatever. Whatever comes to your mind, it's there in the notes. So if you really want to build up on that, you read the notes and then you go back to some other book and you, if you want to, for your own knowledge sake. But I think it's not required. These notes are sufficient and they cover everything that comes in the exam.
Thank you so much on that. And then Reshu asked, were you able to go through all the articles or important articles? Of course, now they have the hot notes. So, would you like to tell them that do they require to do the articles now? Because you also
So,
did some of the hot notes, right? When the hot notes were introduced in your batch as well.
yes, ma'am. So in our time, the hot notes were not fully ready. So they were just coming through when we were studying still. But I had actually gone through, there's a folder called the important articles, which had to be done compulsorily. I mean, there was no way out of that. And but now all those articles have been compiled into the hot notes. So I think instead of doing double studies, and if you're already hard pressed for time, I think you should just go with the hot notes.
Thank you. One question on the Facebook Live I see from Sarah is, how were you able to read the daily task and then watch the lectures also for that day? Because you were also doing 6 hours per day. Amar, what would you say that how are you managing reading and watching? How are you balancing? How many hours to each?
So when I go during my early morning walks, I would be listening to ma'am's videos. I would never watch the video, but listen to the video as such, because it's more of listening that was involved, and that's how I did my listening. Even while driving, I would listen to the videos. When I'm having a free time, I would listen to the videos. Reading, like I said, I had blocked out, since it's my own clinic, I can block out the appointment hours, and in the afternoon, say about from 1 p.m. till about 4 p.m. every day, I would not see any patients. Thankfully, also the way the place where I practice in my country, the patients don't prefer to come in the afternoon. So I mean, it just worked in my favor that way.
Mm.
That's how I managed.
Thank you. Thank you so much, Amar. Great help. And I wish you all the best for the part two. And let's stay in touch. I'll
Thank you, ma'am.
quickly call upon our next speaker, a fabulous, very hardworking candidate, Bhargavi.
Hi,
So
Doc. How are you?
I'm good. I'm good. Bhargavi, a lot
Uh,
of questions are also coming in, but do give a very smart approach. You have prepared very hard. You have kids. You were working, so you're
yes.
the actual the person an example of how you have been juggling and managing because a lot of female candidates struggle with that. I have myself
Yes.
suffered and struggled with that, but especially the ones who are living abroad already, as you are
Um,
as well, with not as much help. How did you manage and juggle everything? Please, your inputs would help a lot of females and moms out there. So
sure, sure. Yeah, first of all, I should thank you and the rest of the team from the Winspert. It's been an amazing journey. It's my second attempt as well. But I should say this is the only attempt wherein I gave 100%. Last time I was not able to give 100% as such because of the time constraints. But I should say I'm a very kind of an organized person, so I wanted everything to be structured, and that is what you will get from this course. Everything ma'am has designed everything in the app right from week 1 day 1. Everything is in display. Whenever you have time, what I did was I watched everything. I followed every day timetable. I didn't even leave one day wherein I didn't watch the videos, and those videos will keep ringing in your ears, and that will build a foundation for you. After giving two times this exam, I have realized that what all they give in the exam is it is all concept based, right? And they will give the deviations. We can't just mug up, like other doctors said, we can't just mug up the answers what were told in the ultimate file or mega master file, which were it will give you an idea about how the scenario can be and how the medical history and dental history can be and how you have to derive your answers, accumulating all the facts from all the articles and hot notes, everything ma'am says, it will build up a concept for you, starting from the past papers and thousands, I should say, because that will give you the dentistry basics that you will not be able. Once you reinforce those concepts, on those concepts, you are building the newer concepts, which will give you a strong foundation for you. That helped me a lot in answering the exams because though some questions we find very familiar, what we read in ultimate file, the scenarios were very familiar, But when we go to the questions and answers, they will change, they'll make very small changes. Like one keyword will be changed, one medical history will be changed. And suddenly we can't block our mind. Okay, we have to think now from the TG what we got, from the medical history what we got. Okay, what is applying to this treatment? For suppose if a patient is having some big medical history, bleeding history, it will not affect your restorative procedures. Restorative procedures you can do aram se. That you should be able to derive. And the answers will also be tricky. They will give the answers in such a way that, okay, everything seems correct. Okay, what is this? Okay, this is also true. This is also true. But we should realize what is applying to this patient. So that will be clear from all the concepts you get through the ma'am, from including the ODEL cases also. That will give you the idea of a differential diagnosis. Ma'am will clearly explain how to differentiate from one disease to another disease, so that if they ask question in another disease, secondary disease also, you'll be able to relate the answers and you will be able to answer the questions. So that is the amazing thing. I believe your foundation will be strong, very strong, and you will be able to answer the questions though despite of any variations they give. Your brain will start to apply. And the amazing thing is the mock exams. First 8 weeks you will give weekly mocks. When I did my coaching, I used to give weekly mocks first 8 weeks. I finished operative in the over the period of 1 week, and the seventh day I used to give mock. And in the mock, I used to analyze. Initially, I was finding it difficult to apply the concept. I used to get less marks, 60% or 50%. I used to get initial stages. Later on, I realized when ma'am start to explain the concept, okay, this is how you have to apply your concept into the question. That really helped me a lot. Okay, now I read, now let me apply to this. That will help you. So after 8th or 9th week, then you will have all the mocks available for you at your fingertips. Access will be there. You can randomly start giving mocks. So many mocks will be there, like you will be left out with no option except for applying the concepts. That is how the mocks will be helping you. That will really help a lot in the exam. You will have at least 10 takes for each mock. Public mocks, ninja mocks, subject wise mocks, ICG mocks, therapeutic guide mocks, everything has a mock, and every concept will go into your mind. And how many times you can give each mock 10 times. So that is a big thing actually. When it comes to last phases after 9th week or 10th week, I used to give mock every day. No single day passed by without giving a mock wherein applied my concepts, and I used to eat ma'am's brain and other tutors' brain. Like, what is this? How is it right? How is it wrong? Okay, I'm thinking this way. Am I thinking right? So you will get answers for everything and evidence based answers. So you will be at peace in your mind when you're answering. Okay, this is support system is there. You have an evidence what you're answering is correct. So that is an amazing thing. And though we got in the last moment of 3-4 months before the exams, we started to get hot notes. That hot notes is another amazing thing. Everything is amazing coming. Every concept or every new thing ma'am installs into the app is literally amazing. That is my dream come true moment. I'm like an academic freak. I wanted to go through academical this thing also. So when I see this, I used to get so much happiness. Okay, this much information is there concised at one area. Okay, whenever I get doubt, if anybody asks me also, I'll say, okay, in hot notes in that topic, ma'am gave this point, you can see that. You will have the answer in that. So that really helped me a lot. Everything what ma'am has given, it is like a spoon feeding. You're being spoon fed. You just have to open your mouth and ready to eat and digest. That will help you a lot. In the exam, you'll realize that when you're preparing, you might be scared. Some doctors have been asking me, okay, I'm finding that I'm not able to retain everything. Am I really getting to say that in my mind? Then I would say, okay, that first few weeks it will be like that only. Ma'am also explained to me like that. I also asked her, what is this happening? I'm not able to recollect anything. Then as the program followed by and I started to answer the mocks and reason the mocks, then I understood, okay, I'm actually applying the concepts into the mocks. That really helped me a lot. So I would say that what all ma'am has given in the app, follow A to Z. There will be no stone unturned. No stone is left unturned by ma'am. Everything is covered. You are covered. You are covered in every which way. You will be answered. All the queries will be answered. So all the best to you. I really recommend joining with Dr. Jigyasa and following her course A to Z. You're sorted. You're sorted for everything. You just need to dedicate your time. See, I'm a mother of two kids. Of course, they are a little bit 10 years and 7 years old. They can understand, but they also need that time, right? Kids will ask, okay, why is my mom always stuck in the room? She's not going. I'm either in the clinic or in the room studying. So they kind of had a hard time convincing them, okay, mama needs to study. Of course, you need to have husband support also, which I fortunately had. So you have to, there is no other go. Our dream and our main aim for our family only. We are doing all these things for our family and for our kids. So for their own good, we have to just explain to them, make them sit at one place, engage them. Otherwise, if you can send them to some play areas or anything, your husband can take, just organize something and cook only for one time a day. Don't keep on cooking all the dishes and all. Nothing will happen for 5 months. Just take a chill pill, cook only one time a day, keep that, and then ask them. Okay, they will be independent also. I realize that kids will become independent for 1 or 2 times or 2 days, 3 days, or 1 month maximum. They might bug you. Okay, mama, what is this? But eventually they will understand, unless they are very small kids. But otherwise, kids from 5 years onwards, I suppose they can understand. They can see the seriousness in you. Now my daughters are asking, is it okay? Is it enough if I study like you? Okay, come on, let me stick the notes. All this, give me the sticky notes, what you have used. I will also use and then study. So they will also get motivated. They will bug you for some time, but it's only temporary. I believe truly at least 5 6 days. If you're working woman, 5 6 hours, you just have to put aside some time. Like other doctors said, when you're going, when you're traveling, please listen to ma'am's videos and don't leave TG and ICG. Not a single day went by without watching TG or reading TG. TG and ICG are very important. Whatever day it is, you please don't leave those two, and follow ma'am's plan. Absolute study plan is a, what you say, it is a cherry, it is like a cherry blossom tree to my eyes. So you can follow everything and you'll be sorted for your exam. That is what my experience through this exam is.
Thank you
Okay.
so much, Bhargavi.
Thank you.
I know
Thank you.
you, I know your journey because every day you were connected with me. And I don't know how many times I have said it in the live class or, in any session that stay connected with me personally. I'm there, tutors are there. We are there to support you 24 hours on a personal chat. I know you discuss a lot of things on group, but grasping a concept with one-on-one discussion with me and
Yes.
versus grasping a concept with 10 opinions on a group at that point is a very different way of learning. Yes, continue to
Yes.
do the student discussion on the group, but having that one-on-one connection with me is absolutely necessity. It's not a choice, it's not an option, because
Yes.
every result after result, Bhargavi, I'm sure, and I have seen it, that those who stayed connected with me one on one cleared the exam. Did clear the exam. That I can now say is the winning
True.
formula, because those who are doubt solving with me on a daily basis, they are having that clarity and that confidence from first day. Of course, you said you were every day connected with me. You also had your demons, right? You also had those the thoughts that
Yes.
what am I doing? It's getting
True.
so tough. I'm not scoring. So nothing that
Yes.
you were also a 95 plus from day one, right? You also
Yes. Yes.
climbed the same ladder that everybody else has to. But at least by staying connected personally with me, you were making sure that from first day, you were seeding the correct concepts. You were learning every day, with me. You were learning the techniques also every. So I would request all the September candidates, if there is the first thing, even above the study plan, even above the classes, the notes, my one-on-one connection with you is I think, the most important thing of this program. And
Yes. You'll get a concept.
even if I have thousands of students, I know that I can strike that balance. That is my USP, and I keep asking them, please come to me, please message me one on one, because then I can understand what's going on in your mindset, and I can shape it. On a group, I can't shape it, and amongst other confused students, I can't shape it, right? But if you connect with me
Yes.
one on one, right, then at least let me shape your mindset, right? So that is one
True.
thing that I request, and I would say that I have seen maximum number of passes from students who had that one-on-one connection with me. Now, Priyanka, if you would like to take the stage, it is all yours. We would love to hear your experience. You've done this in your first attempt. Priyanka, are you there? Sapna, is Deeksha, anyone who would like to go next?
Yeah, ma'am, I came. Yeah.
Okay, thank you, Bhargavi, and thanks again, once again, and
Thank,
now
thank
Priyanka,
you, doc.
over to you.
Yeah. Hi, ma'am. Can you see me?
Yeah.
Yeah. Okay. Yeah. I'm like, yeah, this is also a dream come true because this is my first attempt and I passed it all because of Jigya, ma'am. Because I also didn't have time to finish. Like, I didn't have 5 months to do the course, but still, all her materials were there and it was well structured. So I just studied, I think, honestly, for 2 months, but I spent whole time dedicated. But the course has everything, so you don't need to do extra hard work to find that this everything is there, and you have to study that. Like if you study it with clear understanding, because wherever you have like simple, even simple concepts doubt, ma'am will be there to like clear that. She is always ready for a healthy argument, so whatever you tell, she will be explaining you. And the course also has hot topics and power notes. So hot topics is like where they have compiled all the notes from all the articles, TG, ICG, whatever the important notes, they have compiled it. And then power notes, it's like with how you apply it with the questions she has made, compiling all the related main concepts. So those notes were very helpful, but we got it at the last time. But still, I'm eager because you people are going to use it from the first day. So it will be very helpful. Mm, and yeah, I was like, it's very easy with ma'am to discuss, and you can balance your life, study, family, everything. Like you don't have to sacrifice anything, but still you can learn spending few hours. And like I used to listen to ma'am whenever I sleep also, because like hearing her is like she was my lullaby. I was like saying, ma'am, I used to listen to you. I can't sleep without like listening to your lectures now. Even now, like it was like at least I listen to her Facebook live classes. So every maybe different people have different memory style, like picture memory or like audio. So with ma'am you have all the things, you can listen or you have the notes to see, so you can try anything. It's like the course is designed for everyone, so with all the difficulties or whatever, whoever can do the course. So yeah.
Thank you so much, Priyanka. And I know you have worked really hard. You were, also not keeping well health-wise, and you told me that last few days you couldn't study at
Yeah,
all,
I was sick
but
and
because
like
yeah,
because of your course, like I don't know, when I was seated like in the exam, I never felt it was like, oh, it's hard. Like I know the concept, I just have to apply it. Like I just forget I'm sick, so I was like doing the exam, but I was sure when I came out I will pass. When I came out and I just said you like, ma'am, I'm thinking I will make some of the mistakes, but I think still I'll be able to crack it. So it was because of you. Yeah.
oh, but
So
God
it's a
bless
great
you,
big
Priyanka.
thanks to you.
It's the light in you, it's the confidence in you. I would say always may that spark always remain alive, always remain smiling like that. I wish you all the best for your part two as well.
Thank you, ma'am. We'll be
Always.
missing you and keep in touch with you forever.
Yes, for
Thank
sure.
you.
Thank you. Thank you, Priyanka. Sapna, would you like to go next as I have a line, and Jolsna, then you can go after Sapna.
Okay,
Hi, Sapna.
everyone. My voice has gone. Can you hear me?
Yes, yes, we can hear you.
This is my first experience. I had never um, participated to any other course before. Luckily, I found you on Facebook when I was scrolling, and I first started watching your public sessions, and I was able to understand every each concept you explained. Ma'am, can you hear?
Yes,
Can
absolutely, we can hear you.
and actually first I wanted to complete my initial assessment. After that I messaged ma'am and I joined, and I studied, I joined in August 2024. So I wanted early preparation because I am stressed at the last moment. So I just prepared early and followed your study plan. Initially it was very hard for me to go with the study plan, and after passing after passing 1 month, I was able to completely cover your each concept. And actually I watched your thousands those thousands and past papers, I was able to build up a basic level knowledge. It helped me a lot, and actually I enjoyed reading articles. And when I learned every new concept, I enjoyed, and it was actually enjoyed learning. And you was and when actually I was lucky to complete my study plan before 2 months of before 2 months for the exam. And I again revised every concept. And I especially I want to mention about support classes. Dr. Kalai, Dr. Anj, uh, they were also very helpful. And I didn't have a study partner. I studied alone. And my study buddy group members were my study partners. There were a lot of new questions and arguments, and I learned every concept from those also. And whenever I had any doubt, I used to message ma'am, and she was there for help me. um, and actually examination. And don't give up until the last moment, because I learned a lot in the during the last week of the preparation also. uh, because I think everyone don't should not give up until the last moment. Because when I was preparing for mocks also, we can do again and again 10 times. So if you make mistake, you can learn from mistakes. So I think that's about my preparation. Thank you very much.
Thank you, Sapna, for sharing your experience. I would like to call Jolsna. Would you go next, please? And Merin, after Jolsna, I'll take you.
Hi, ma'am. How are you?
I'm good. Thank you. Congratulations, Jolsna.
Thank you so much. So, my story is a little bit different. I am a crash course student of Winspert. So, basically, when I started my preparation in 2024, I was in India and I had lots and lots of time to study. But unfortunately, I couldn't find Winspert at that time. And I had joined another coaching. So, in between, I attended one of the free public session of Jigyasa, and I found the class was really interesting. But by that time I already had paid for the first coaching, so I was unlucky at that time. And but I used to regularly follow her public sessions, and I prepared 100% from my side. I even had a study partner. We used to discuss everything. As ma'am has always advised in the public session, you have to be thorough with your TG, the ODALE, the infection control guideline. 5 time revision is a must. So everything I followed, but I couldn't crack it in my first attempt. I just lost an info gathering cluster. So even after giving your full like full hard work, when you don't get it, so you feel kind of depressed. And that was my first time I was facing a failure in my exams. So that was kind of like so much I was disheartened, I was depressed, and I was like, oh, what am I going to do now? So by that time I had moved to Australia, and I have a 4.5-year-old kid. And it was the second attempt. Actually, it was a completely different experience because back in India I was having so much time to study. My parents were there at home, but here I had to manage my home, my kid. I started working as a dental assistant, so I had to manage everything. So actually I was so depressed, I was not prepared to attend the second time. And then once I messaged Jigyasa ma'am, and she told, don't be hard on yourself, you will clear it because you just lost in one cluster. That was the most difficult exam, so don't be hard on yourself. And she just sent a pic. I still remember that it was showing the different phases of the moon. And she told that even though the moon is a whole, even though it is in a different phase, you are the whole. So don't be so much depressed about your this phase. You will go, you will overcome it, and you will get the result. So I trusted her, and it was like kind of so much inspirational to me. And I was thorough with the therapeutic guidelines and infection control guidelines. And so I thought I will join the crash course of Winspert, because all the other things came under the crash course, and so I joined the crash course actually. And about the study planning, I didn't get any time to study properly. Only time I heard the classes were while traveling in bus to work. So it was 1 hour for traveling from my home to work. So I used to listen in the bus, all the classes, everything. And I was sure that I will not be getting time to revise all the classes. So whenever I listen to the classes, when say, ma'am tells some important point, if I am at home, regarding some discussing of some question, I used to write some points, even though ma'am tell don't write, but still I used to write because I was sure that I'll not be able to revise it again. So all those, one notebook full was there with notes, so I only read that note just before my exam. And only during weekends and then during the traveling to work I got time. But still, even I'm having work in kitchen after coming home after work, but then also while cooking I used to listen with my headset all those classes. And I was not able to revise everything, so I just completed 50% of the course just before my exam. But I made sure that I have completed all the important classes and all the mock exam, the public mock, the grand mock, the x-ray mock, the trauma guidelines mock. All those mocks really helped to a great extent, because even though you are reading the concept and learning, once you try the mock, then you realize that okay, this point I didn't read, this point I was not able to see that at that point. And therapeutic guidelines is highly volatile. How much ever time you read, you will miss out somewhere something. So for those preparing students, I would like to really uh, give importance to therapeutic guidelines, infection control guidelines, or DAIL. That all things should be like pakka. You should be well thorough. 5 times, as ma'am always tell, 5 times revision is must. And along with that, the articles. So what I realize now is that my first attempt I lost it because I didn't have access to those much articles. And also I didn't have a 24/7 support from someone, the guidance that I got on one-to-one messaging. Even if you ask any simple a silly doubt, ma'am is ready to answer it. And like, even if you have how many ever doubts, at what point of time she will reply to it. So that was the best part, because in group I was not able to follow the group properly because I didn't have time that much, and so many messages came in the group, so I was not able to follow everything. But whatever I had doubt, I directly messaged to ma'am, and your concept is so clear with that. So I highly recommend Winspert, whether it is crash course or full course. I highly recommend Jigyasa ma'am's guidance. That's the most important thing you want. Whether it is based on theory or mental support, whatever you have, you just message ma'am. That's it. You will get it through. All the best to those who are attempting this time, and those who have not cracked. Even I had gone through this phase. I just missed one cluster in my last attempt, but still you can make it with Jigyasa ma'am's guidance. I believe so. Thank you so much, ma'am.
Thank you, Jyotsna, and thank you for reminding me the moon phase interaction that we had. It was
Yeah.
beautiful, actually. I think probably at that time I was also going through something personally,
Okay.
and when you
So
came
it
to me,
was,
and I was like, "Let's heal together," and then I shared that with you.
yeah, it was
So
so much supporting to me. Yeah.
thank you so much, and congratulations and all the best for your part two. I would like
Thank you
to
so much.
congratulate you once again. It's
And I
all
would
your
also
hard
like
work.
to, yeah, I would also like to tell those who are in Australia, if you are working as a dental assistant, that will also help you in lots of way, like to know about the sterilization procedures, the infection control guidelines, especially. It has helped me in a way, like for the exam. Yeah.
Thank you for adding that. Merin, I would like to invite you. Please share the stage and please share your insights with everybody.
Hi, ma'am. Hi, all. First of all, I would like to thank God. And secondly, of course, Dr. Jigyasa, ma'am. Like, I still remember the first day, like, we have started the chat. Like, it was like, oh, ma'am, I was asking, like, I was just a BDS graduate. Like, I just passed out 2 years back. And I was also working in a non-clinical field. So I was like, I wasn't very self-doubts that, like, whether I will be able to crack this or not. But like from that day till the exam day, like what she was saying that you can do it, you can do it, you can do it. And like for all the ADC aspirants, like I have only one thing to say, like just blindly follow her plan and blindly follow, blindly read what she's asking us to read and what she's asking us to revise. And for me, the most important thing that helped me was the advanced file. Like because I love watching that classes, not just that 70-page file, because the way she solves that questions, that was kind of interesting to me to listen to that videos. It might be 2 hour videos, sometimes it may extend beyond 2 hours, but like it was very interesting for me to watch that classes. I think I have revised almost 5 times that classes. While attending the exam, also, I think that helped me the most. And also, of course, TG and ICG. I think I have read it for 6 or 7 times, and also other articles. I think we got only like our hot notes by in the mid time, so I was only able to read it for once. So it will be very helpful for the September aspirants. It's about like going through the drive is plenty. Like we don't need to go any extra beyond that. She had provided everything what we have to go through. Try to study in a structured or organized way if it's possible. And like I was like that. And during my, I have started my preparation in October. Like I was also working for the 2 months. Like I actually for the last 3 months just before the exam, I gave myself to the exam because I used to study 8 to 9 hours per day, like for the just for December, Jan, Feb. And for the first 2 months, I got only just 5 to 6 hours per day. Sometimes it might go to 3 hours per day. But I tried to give my best during my last 3 months, and I think that really helped me the most. Uh, and and for the September aspirants, I just am telling that like do your best with what you have. Don't get too much stressed. Like if you are getting too much stress, just message Jigyasa ma'am. Like she will she is not just a teacher, like she is a great mentor, like great supporter. Like rather than teaching or gaining knowledge, like we will get highly motivated, like not just for passing the exam, for like getting structured in with our life also. And thank you ma'am, thank you. With no doubt I can say, like without your help I will not be able to clear this exam. Thank you ma'am, thanks a lot.
It's all your hard work. I'm just maybe, pointing out towards the direction, but without your hard work, trust me, you wouldn't have been where you are. That is 100% your feat. So I would like you to bask in that, celebration and, give yourself that credit that it's you who listened and just followed. The action part definitely came from you. So congratulations once again. Thank you so much, Meryl, for
Thank you
sharing your
ma'am.
experience. Diksha, would you like to? We have last 10 minutes for this session, and would you like to please take those 10 minutes and share your experience? Sorry, your mic is turned off, Diksha. Let me
Am I
just.
audible now?
Yes, yes.
Yes. Firstly, I think we have to thank Dr. Jigyasa for being so supportive for the entire journey, right from the start. There were days, as everyone else has mentioned, where you are doubting yourself a couple of hundred times. But with Dr. Jigyasa's guidance, it was really helpful to just muster up the courage once again and just take on this journey that is quite demanding in itself. So, what I thought of doing for everyone was I'll just compile everything so that it's easier when people are falling back on this video, because I know I did a lot of that during the entire course. So, that helps everyone, whoever's watching it at a later duration of the entire ADC journey as a whole. So I'd start by saying that since we have an entire roster, it does get a little overwhelming, of course, but with your proper determination and time management, it's definitely possible, even with you being working in the clinics for however long you are. So, firstly, I would say start your week on a Sunday and start with articles, because what that does is the articles become your backbone to solving your thousands and your past papers. The moment you have the clarity from the articles, your thousands and past papers, they're easier to solve, and you're also saving up on time, wherein you're not writing down every single word that ma'am is saying in the classes. I had just one tiny notebook for my thousands and past papers, and it was really helpful because towards the fag end, when you're revising, a small notebook is what you want so that you have just crisp details of snippets of information. So I would definitely suggest that you start with the article since we have the hot notes now. I'm sure it's going to be really helpful for a lot of people. So start on a Sunday, take your Sunday and Mondays for articles, completely revise it, make sure that you have a rough roadmap of it, and then you move on to your thousands and past papers. I revised my thousands and past papers, I think, only once. So because I had my articles at hand and it was really helpful. So that was one thing I would have to say. Second would be try and get as many printouts as possible because time is money at the end of the day. And if you have a hard copy of something, or even if you're someone who likes to fall back on an online format, do that, but make sure that you're marking everything according to the color grading that Dr. Jigyasa mentions, even in TG and Odell, ICG. This is the backbone of your concept. So it is better that you take your printouts so that you can fall back on that again, and it'll help you revise better when the last couple of days come. And along with TG, ICG, and Odell, what I really felt was important was definitely your trauma guidelines and your Ivan's articles. I feel like that becomes a really good foundation. Additionally, what I also did was we had an amazing set of X-ray mocks. I think that was a game changer for me, definitely, because I did have screenshots of White and Farrow that I would fall back on. But the X-ray mocks, wherever I went wrong during the live classes, I was just taking pictures of it and I was saving it right on my WhatsApp itself so that I knew that even before the exam, I would know the exact answer or exactly what radiological anomaly that I need to be looking at right before the exam. So radiographics, as far as the X-rays were concerned in the exam, even for perio, it was a very smooth ride for me. Thanks to the X-ray mocks. Ma'am, I think you did a phenomenal job over there. Then moving on to the support classes, I would say that Dr. Kalai and Dr. Anj were wonderful. Again, just make sure that you're making really compiled, concise notes because time is money. So just fall back on what Dr. Kalai had really good concepts for prosthodontics, and Dr. Anj had amazing concepts for ortho, I feel. So I compiled both of those and I made sure that I was, aligning it with whatever I already knew about. That was another thing that I had to mention. I had like just pointers, ready so that it's not costing us people a lot of time. Yes, and then I would say the ultimate advanced file is the Holy Grail. I revised it, I would say at least 4 or 5 times, if not more. What I would suggest everyone over here as a Winspert candidate would be in the initial part, there was a lot of confusion. So the best thing that you can do as a candidate is just listen to Dr. Jigyasa because the moment you start with your advanced files, ma'am already has these pearls of wisdom that are coming from years and years of experience. So the more you listen, the more you're gaining out of it because ma'am is probably going to cover up a particular portion that maybe you would have missed out on initially, or maybe it would be implemented later on during the course. So definitely pay a lot of attention to the ultimate advanced file classes. Make sure that you're having concise notes over there as well. And be very focused on having multiple options ready. So what I used to do with the ultimate advanced file is if we had 4 options, I would make sure that I'm marking the different approach over there as well. So in my notes itself, I knew that I'm already preparing for a different approach that helped me during the exam because 50%, 60% of the paper would be similar to what we're studying, but you have to be ready for the newer questions. And that really helps you understand and conceptualize something that might not be familiar to you, right? Then I would say, well, towards the end, for the last 2 weeks, it was all about mindset. You have to make sure that whoever you're surrounding yourself with, be it your study partners, your friends, your family, your clinics, it has to be a supportive environment. Make really good study partners, I would say, because that can make or break your preparation if you're the kind of person who prefers having study partners. I was really lucky with mine. We had someone who was based out of Australia. So even when we were discussing our ICG, since ICG was new this time, we were discussing it over videos of her clinic, wherein, I was trying to understand the entire protocols because, we're internationally trained dentists. So we're not quite familiar with the entire protocols that are being followed over there. So visualization really helped. And as far as the exams are concerned, the mocks, beautifully structured, I would say. The grand mocks were really, really good. They really helped you understand where you're making mistakes. And one thing that Dr. Jigyasa did mention to me, which I followed to the T, was just keep taking attempts. From 1.5 months to the day of the examination, I promised myself that no matter what happens, I will be taking more and more attempts. And that brings you so much of clarity of thought on the day of the examination because nothing seems alien to you at the time. So I would definitely suggest that you take more attempts, more mocks. As Dr. Jigyasa would suggest, marks are not a criteria. Do not associate your worth to what you're scoring because in the end, I mean, we're all here celebrating our success and it's all because of Dr. Jigyasa. So thank you so much, ma'am.
No, thanks, Deeksha. And again, the credit goes to individually each one of you who listened and then worked on it. So that's what I said, that I can just lay out the plan, I can meet you halfway, but I do want you all to meet me halfway as well to get successful in this examination. That's the number one thing, because I can provide you information, I can consolidate it, I can organize it, I can create a roadmap, but you have to walk. I cannot walk the path for you. So absolutely, it is all individual hard work that has gone in. And of course, those who couldn't do this time, there is still a silver lining for the fact that the pass rates are also thin, right? They are also not like big pass rates for this examination. So slowly and steadily, what everyone should aim for is to get in the higher cutoffs. That should be your individual game plan, that I have to be in the higher cutoffs. And to summarize everyone's experience, be it Diksha, Bhargavi, Amar, or everybody, one thing which is a common pattern that is emerging is that the more practice and a sincere focus given to that, yes, overwhelm and the that kind of feeling is natural. Everybody will feel that because it's 5 months and a huge 5-year degree that you're practicing all over again. So basic thing that you must focus on is all the mocks have been provided. Attempt them not once, not twice, but at least 2, 3 attempts to see that whether you're grasping the concept and then applying it. Don't leave it for the examination center. Revisions are important. If you're not able to do complete study plan, not able to go 20%, 30%, 40%, it doesn't matter. They are there for your help. They are not the ultimatum. They are there to help you and guide you, but they're not the ultimatum. Ultimate driving force should be, am I revising everything enough that I will remember it in the examination and I will be able to use this and apply this concept to the exam and get the correct answer. That's the ultimate goal. And that will come with revisions. If you have less time, focus on lesser portion, but do it multiple number of times. You don't have to do everything if you don't have the time, but maybe don't do thousands, don't do past papers, but then do only Mega Master and Ultimate Advanced File and then just keep revising them. Right? So I think if you have less time, focus on few things and repeat them again and again. If you have maybe 8 hours, 7, 8, 10 hours, then do everything and then repeat also. So less time or more time, repetition is the key to crack, whether for mocks, whether for listening the classes, or for your reading the material. Everything will boil down to your repetitions and revisions. So because I have felt a lot of students who could not clear in this attempt or are thinking of September also, even had not attempted this March, they are now confused about if they are reattempting, what their approach should be, how should they study. We booked some scheduled some classes also with our consultant. Dr. Anj was also telling me in the morning about the classes that she had scheduled, the calls that she had scheduled, that most people are concerned about how to reapproach it, how to study now. So Erica, I read your question also on the group other day. I that also it is like constantly playing in my mind, the message that you sent. So I need to answer all those things and clarify those things again for you. We are in week 2. I think it's still very beginning. So to have a clarity from the beginning, I'm planning to have a class on the coming week where I will be talking about again how to reattempt, right? Or how to prepare in these 5 months. If it's your second attempt after March exam, what you should be focusing on. If you have lost some clusters, how I'm bringing a new feature which will help you even practice some of the clusters more than the others. If you are anxious about a certain cluster, so we are bringing a new feature which will help you also give cluster wise practicing, cluster wise mastery. So to address everyone's questions, Erica, be it you who has not taken the exam but is worried about what my course progress is not increasing, or people who say I don't have 8 hours, I don't have 7 hours, but try to get at least 4 to 5, right? Anything below that is not fair to the system also, right? So you have to see that otherwise people will overwork you and they will outperform you. So 4 to 5 hours you must keep in mind. Then I will be addressing it once again. 4 to 5 hours, guys. 7 to 8 hours, I'm going to put both the study plans again all over with thousands and past papers optional in 4 to 5 hours study plan. And then with part of the program, thousands and past papers for a 7 hour plan. So I will put both these study plans on the drive now again. And Nivedita, I will also guide how to follow everything in phase. Yes, I will also talk about that how to make it customized also. If you can't do weekly plan, week wise, day wise, if you have that approach of focusing on certain things, I will also include a discussion about that. So next week I'm planning to have a session specifically for the reattempts from March 25, how to restudy, what to focus on, and how we are bringing a cluster wise individual preparation technique as well. So I'm going to talk about that, and the existing September candidates who have not done the exam yet but still want to find more clarity about the study plan. So I'm planning to cover both the perspectives in the coming week, and my team will be announcing it on the group and on the Facebook page. So please make sure to watch that class, attend that. So reattempts, definitely Japinder is on my mind, because how to reattempt the ADC and how not to give up. Because one thing is, see, if the ADC is picking the top scorers, right, and the cream of the lot, 10-15% of the lot. So what we need to strive for is to get into that cream, right? So if I give you an example of churning the butter, right? I mean, you have to keep churning it till the butter comes on top. So similarly, you're also churning your brain. You're also churning with all this dedicated attempts and efforts and months. Sometimes it takes more time, sometimes it takes less, but the ultimate goal is to strive to be on that and become that cream. Now this is an out there fact, right? It is nothing that I'm making up, it's nothing that's hidden. Even ADC is not trying to hide anything from anyone. These are all things which are clearly laid out to you, that the what is the pass rates, what are the and the level of the difficulty of the examination, and then you've seen that how much you can score, and then what are the grades which A and B are passing. So it is clear that there is a certain cutoff that you have to make to, and that cutoff seems, yes, is leaner, right? And this can change year by year, this can change every month, every intake by intake also. Right now it is a leaner cutoff rate, it's a leaner band where they're taking the candidates from. So our only target is to keep striving to at least get into that leaner band. If it is lean right now, this is what it is. These are the stakes involved. We have set up our goal as that. then let's find a solution. Okay, I'm at this stage, and this is what requires to crack this exam. I have to go from point A to point B. Simple goal, take the steps required to go there. That is all. If you're not making it to that point, or if you're not going and arriving at that point, simply reevaluate your steps, simply reevaluate your approach again. But remind yourself, it will require some persistent effort, and I will then crack it. But I have to get into that certain lean cutoff zone, right? So I have to go beyond that, and only you can, because internally, always you will know how much you're retaining, how much you're remembering, how much your application of the concept skills are developing. I can train you for those skills. I can give you methods. I can give you information and skill, both combined. But at the end of the day, tell me honestly, is it only just you or not who would know that am I acquiring those skills or not? So, me giving you information and me giving you methods, and then you developing and acquiring those skills, then it becomes the recipe of success, right? And absolutely, it's doable, but you have to get more serious and more determined. If you're not making it now, sit back and evaluate where the shortcomings are coming from. Where the shortcomings are, is it the time problem? Is it the retention problem? Is it the application problem? Is it the basic that I'm not understanding the concept only? So you have to keep doing a self evaluation on a regular basis. So 8 years, 9 years into the teaching, when I prepare for the class, I have to reevaluate my concepts, keep myself updated with the latest guidelines. I cannot keep teaching the same concepts from the last 8 years. I cannot keep teaching you the same things over the last 8 years. I have to evolve and learn with you all as well. What's new? Okay, new endodontic guideline has come up. New intracorneal bleaching guidelines have come up. Let's stay abreast, let's stay updated, and keep applying to the examination. Oh, the VRF studies have changed, the VRF outcomes have changed. Let's keep applying. So it's a constant evolving process. The science is evolving, the syllabus is evolving, the exam is evolving, the pass rates are changing, getting sometimes fatter, sometimes leaner, which is fine. If I have decided I want to move to that particular country, I want to practice there, and this is what it takes to enter their system, then I have to, work hard and then be there. I will be, if I have to be the part of that system, I have to perform what's expected of me to practice there. So these are sometimes facts, but sometimes we get emotional and we get frustrated, which is totally normal. Happens to me, happens to best of us. Even happened with the ones who did it this time. Nothing new. We are humans. We'll always have those clumsiest of feelings. But amongst everything, we also have the capacity to feel and see that light, have that clarity. If you're always fogged, and if you're always hearing people, oh, it can't be done, it is so thin, these are facts. Pass rates are fluctuating, it is fine. But we decided to move, we already took that step. So we have to accept how difficult or challenging our road is, but then we have to find the ways how to, navigate it. So be in a supportive environment. One of the students said, Diksha also said that it really matters ultimately what your mindset is. If you're constantly in a negative thought process and a loop, it will affect you no matter what. So your mindset has to be elevated. You have to feel like a winner to be a winner. Fake it till you make it. Feel confident. You have to, throughout the journey, have faith that this will be done by you, and then you can and you will. So this attitude will definitely come. Academically speaking, there is lot of information. If it is lot for you, we will shrink it down. If you think I want to do everything, you have everything. If you want to cherry pick something, you can do that as well. So that's the beauty of the program. You don't have to do it 100%, because it has so many methods to learn the same thing. Thousands are there, past papers are there, Mega Master, Ultimate Advanced File, TG and guidelines, and then mocks, and then hot notes, and then power notes. So there are three techniques: listening, reading, and application of the concept in a mock. All the three methods are there. Pick your favorite and continue to repeat those methods. If you don't like listening to classes much, focus more on reading and taking mocks. If you like doing the classes and do not like reading much, maybe repeatedly watch the classes more, right? And then take the mocks. But mocks are not negotiable because that's the examination style. So reading versus video, I can still ask you to skip one of the two things or maybe reduce something and then maybe focus on the other. But mocks, the more attempts you take, the number of attempts that you take, even with the same mock, when you're repeating it in the reattempt, you will see that something that you missed out in the previous attempt, now you were able to apply it in the next attempt. So if that is the case, then you see the more attempts you take before the exam, by the time the more mistakes you are fixing by reattempts of mocks in the exam, those mistakes are also reducing in number, right? So that's the whole idea behind this. It's an academic path that we have chosen. It requires what is done to study. So it's an absolute academic approach to the part one exam with the clinical knowledge. So you have to learn the skill how to apply your guidelines in the patient environment, to the patient's medical history, so that very critical and clear thinking is required. And that's all. Yeah, thank you so much, guys. If you have more questions, feel free to ask me. And yep, absolutely, I'll be answering all your questions on the WhatsApp as well. As I said, next week we'll be talking about what and how to do the reattempts. And thank you so much, guys. I'll see you next week then. And if you have more questions, please drop a message on my WhatsApp or my Facebook page. Me and my team would be happy to help you. Thank you so much.